Good morning. It's 9 o'clock, so we're going to start the Sustainability Scale Up and Access application webinar. I'm Dan Rittman, I'm PHET's Evaluation and Learning Manager. Thank you for logging in today. We've got about 60 minutes today, and we're going to have, well, at this point you won't be able to speak. You should be able to hear me and see our screen. If you can't, then type a message in the box, and we'll see what we can do. Later on there'll be some question and answer time, about hopefully about half the webinar, so plenty of time. And at that point, you'll be able to unmute yourself or type a question. So today we've got on the panel, as well as myself, there's Sophie Pinder, the Monitoring, Evaluation and Learning Officer at PHET, Salman Shah, Grants and Finance Officer, and Paris Tuo, Grants Officer. And I am going to take you through just an overview and introduction to the Health Partnership Scheme and this call. And then Sophie will go through the grant application form in some detail. Someone will talk you through the budget template, and then Paris will go through the application process. And then, as I said, there'll be plenty of time for any questions that you've got, and we'll do our best to answer those. So, to give an overview of the scheme, which of course some of you will be very familiar with, the Health Partnership Scheme, the HPS, is a programme funded by the UK Government Department for International Development, DFID. PHET's been managing the programme on DFID's behalf since 2011, and the programme supports health partnerships between UK health institutions and health institutions in low and middle income countries. And the aims are up there on the screen, but they are to improve human resources for health and health services in low and middle income countries through UK health institutions and professionals volunteering their time to build the capacity of their counterparts in those countries. And conversely, to bring benefits back to the UK through the volunteers returning with more knowledge, more skills, leadership skills, and a greater understanding of how to deliver healthcare innovatively with limited resources. You can see from the map that is about to appear that a sort of overview of the projects funded. You can't see all the details, I understand, but you'll be able to look at this more closely in our HPS impact report, which we are going to be publishing imminently. So you can see that over the last 7 years we have funded projects in fact over 30 countries. I think it's nearly 250 projects addressing 12 health themes. And you can see on the right-hand side some of the sort of headline achievements: 84,000 health workers trained, 95,000 days spent volunteering, and a lot more of the details, as I say, are available in our impact report and in many documents on our website about what's been done and what's been achieved. To find out more about that, DFID commissioned two agencies to do an evaluation of the HPS. That's Triple Line and Health Partners International. This is the cover of the evaluation that they produced last year. It was a thorough process that took about 8 months. The report is available on our website and on DFID's Dev Tracker website, along with our responses to it. But broadly, the things that they found about the scheme were that it is effective, that the health partnerships have have improved health worker skills and services. And they made several recommendations which are important now because we've taken them into account in developing this new call for grant applications, the Sustainability Scale Up and Access call. So among the recommendations were that we expand health partnerships to wider health facility and community approaches, that we seek to improve learning synergies and in-country coordination between health partnerships and other actors in the health sector. Partly, I think, by focusing the scheme a little more. That we strengthen the performance and evidence base of health partnerships so that they achieve better outcomes, impact, and value for money, and that they can demonstrate that. And also that we integrate gender equality and social inclusion much more clearly into project design, implementation, and monitoring, evaluation, and learning. So that's where we've got to with the HPS. That's where we had got to, I guess, up till a couple of months ago when DFID granted an extension to the programme, which will now run until February 2019. This extension includes a relatively small, I guess, budget of £1.5 million for small and large grants. There's going to be, again, a relatively short implementation period for grants of 12 months, which for health partnership projects in a limited number of countries. That will be, we anticipate signing contracts with successful applicants in about November, and then grants running until November 2018. The overall aim of the extension is to support sustainability, scale up, and access. As I said, that this is a response. This focus is and country focus there, which is so the countries eligible for grants are Tanzania, Uganda, Zambia, Ghana, and Myanmar or Burma, and those two focuses are responses to the HPS evaluation that I mentioned and if it's existing priorities and strategies. Now on to my colleague Sophie, who's going to tell you more about grant eligibility and the criteria for assessing applications.
Thanks, Dan. Hi, everyone. So before we look at the application form in more detail, I want to spend a bit of time talking about eligibility. So you've got them up on the screen right now. So the first criteria are that institutions involved in the health partnership must be eligible. So this would be a minimum of 2 institutions, one in the UK and one in the low and middle income country. And you can find more information on the type of health institutions that are eligible in the Q&A document. So it's quite an important document because it will go into more detail in every aspect of the calls for small and large grants. You can find these as handout documents as part of this webinar, but also on our website. So the lead UK partner must be an eligible health institution, not an NGO. So the lead UK partner will be the contract holder with FET for the grant, and will be responsible for reporting and also kind of the overall oversight and management of finances with their low and middle income country partner. NGOs and charities can be involved in the partnership if they wish, but you'll need to demonstrate the value of this in the application form. So this stream is designed to fund established health partnerships. So what we mean by this is partnerships that have already a track record of managing projects, of receiving funding, either through the Health Partnership Scheme previously or from other sources. So here we're not looking to fund startup grants to set up partnerships. So I won't go through criteria point number 2 and 3 because they've already been covered by Dan. But in terms of the fourth eligibility criteria, small and large grants, here on the screen in red. So they're slightly different for small and large grants. So for small grants, projects must be operating in one or more low and middle income country health institutions, whereas for large grants, they must be operating in more than one, meaning at least 2. And you'll find more information on the differences between small and large grants in the Q&A document, but essentially there's the scale, so the number of health institutions the project will be implemented in, and also obviously the amount of funding that you're applying for. So this is pretty self-explanatory, hopefully, from the application form and the core documents. But so what you need to submit is the application form and the budget template by midnight, the 1st of October. Please use these templates. We won't accept applications that are in a different format. And if you're using another operating system than Microsoft Word, such as Mac, you might want to check that there aren't any formatting issues before you submit. Please do not apply if you are not eligible. It is a competitive grant stream. We will have a number of high quality eligible applications. So if you're not eligible for this grant, we won't be able to consider your application and it won't go to review stage. So it would be a waste of time both for you and for us. If you're not sure, you can always drop us an email or call us, and we'll be happy to tell you whether your project will be and your partnership would be eligible or not. One partnership can apply for more than for funding for more than one project, but these must be submitted as separate applications and preferably separate emails. Right, so moving on to the review selection criteria. So up on the screen I have the project requirements, and then on this second screen the partnership requirements. So these requirements form the selection criteria for the applications, and you will be assessed systematically against all of these points. Once again, I strongly advise you to refer closely to the Q&A document for a more detailed explanation of each of these criteria. You could also use these as a checklist when you're drafting your application to make sure that you've covered each of the points. We advise you to fill in the application form before the budget template, as you'll see later that they are closely linked. So now I'm just going to open up the application form. So please avoid using kind of acronyms and technical terms to make your application as readable as possible, especially for reviewers that aren't familiar with your area of work or your project. In terms of the summary details up on the screen, section 1, the funding category, we advise you to complete that once you've completed your budget template to make sure that you select the category that actually applies to your application. The duration, so for periods of 12 months, that's already included here, and project start date, bearing in mind that projects must be completed by the 30th of November 2018. That kind of gives you an indication of when they should start. For this section 2, partnership, this is a chance for you to tell us about your partnership, and please assume that we don't know about your partnership, even if you've received previous HPS funding. You can explain the history, how it was set up, when it was established in section 2.2 and 2.3. Please explain what you've done together as partners and describe the grants that your partnership have received in the past. You can also tell us how much it was for and what you've done with it, and what would be really helpful for us to assess your partnership and your project would be kind of to give us an indication of how successful your previous projects were and the kind of impact that they had. For section 3, justification, question 3.1, we're asking you to describe the health system changes you have previously achieved. So just be clear on what we mean by health system, and there is a clear definition in the Q&A document, including some very helpful examples. For section 3.4, so here we're asking you to, we're looking for information that the project you are proposing suits the local context and that you've considered other organisations working on the same issue in the same area. So here we want to make sure that you're not kind of duplicating efforts or duplicating work, and that your project doesn't significantly overlap with what's already been going on the ground. So section 4, project description. So here we're going obviously more into detail on the project that you're proposing. For those of you who are familiar with completing previous HPS funding applications, you'll see that we're no longer asking you to complete a project plan with outputs, outcomes, indicators, targets at application stage. But do bear in mind that we might ask you to complete a more detailed project plan if you are awarded a grant. So here we're asking you to describe the changes that you expect to see as a result of your project at 2 different stages. So at the middle of your project, so 6-month period, and also at the changes by the end of your project. So by the middle of the project could be kind of right after, for instance, an activity or an intervention, such as a training course, and then by the end of the project would be kind of the next stage, what you expect to happen by the end of your project. So for those of you familiar with monitoring evaluation, this would refer more to kind of outcome level changes, and we have some really good examples that are in the Q&A document. So if you're not too sure what we mean by what type of changes we mean, please do refer to this document, because that will be your best way of finding that out. Please do not add more than 4 changes for each of those stages, because these are, well, you'll see when you open the budget template that this form is closely linked to the budget, and if you add more, then it'll make your filling in your budget template much harder. So what you can do is include just the kind of the main changes that you expect at these 2 different stages. Okay, so moving on. So I think that's all I'm going to cover for this section, but then moving on to section 5, project management and support. So you can refer to the partnership requirements section, so what we saw on the slide earlier here, and also some of the points in the project requirements that are included in the core. So here we're in under 5.1, we're looking for information that will help us assess your partnership's capacity to deliver the project. So please note that if your project is shortlisted, we might ask you to provide documentation to support this, such as memorandum of understanding, letters of agreement, and we could also ask you questions around this, around your policies and systems, if you're invited for a project meeting, an interview. For section 4.2, I advise you to refer to the principles of partnership, which are on our website, and they're kind of hallmarks of good practice for partnership working, which could be helpful for you to refer to if you're not familiar with the partnership model. And finally, so sections 5.4 to 5.5 concern the volunteering. So please make it clear whether you're sending short-term volunteers, long-term volunteers, or a mixture of both. A number of volunteers will be helpful too to provide. And so in section 5.5, we're looking for information that shows that you have policies and systems in place to effectively recruit and manage volunteers. And again, we might ask you for supporting evidence of this if your project is shortlisted. Right, so now I'm going to hand over to Salman, who's going to cover the budget template.
Okay, thank you, Sophie. Hi, everyone. So some of you who are already familiar with the budgets and financial reporting from previous funding calls, you'll notice that this budget is quite different. Some changes have been made, and so this budget template has been updated following recommendations from the HPS evaluation that Dan was touching on earlier. We believe that this new format will help to better capture the value for money data required to meet our reporting obligations to DFID. The main difference to the format are the new sections for each expected change resulting from the activities that you'll be undertaking as part of your projects. And so the template contains sections for up to 4 changes. So when completing the budget, please specify the change where it's requested and ensure that the changes correspond with what's been stated in your application form. There's also a section at the top for general project costs for those overheads that may not relate directly to any of the changes. And then at the bottom of the sheet is a summary section. This section is locked. It contains some formulas, and these will populate the cells as you complete the template. Though the format of the budget has been updated to incorporate the change element of the projects, the categories remain largely the same as previous budget templates. These still include project management, equipment and refurbishment, travel, and monitoring and evaluation. The main change is in categories is project activity. And so this new category replaces what was previously training and capacity building, and it represents each activity being undertaken to achieve the change or changes you have set out in your application form. When completing this section of the budget, please specify each activity in column A and provide a description of the cost related to this activity in column K. And these activities again should correspond with what you stated in section 4.2 of your application form. You can insert additional lines if you have more than 4 activities, but we would say that please consider time frame and resources when you're planning your activities. As mentioned earlier, there's only a 12-month period to to carry out your project, and so maybe 4 activities would be more than enough in that period of time, but we leave that judgment to you. So the different sections of the budget. When completing the form, Sophie mentioned earlier, we would recommend that you first do the narrative, where you can set out your changes and activities before you attempt the budget. So once you've established the changes and the activities, you can begin to consider the related costs. And then in the budget, you can begin by entering your project details, and this is in the top right of the sheet. And these include the name of the lead UK partner, the title of your project, and who will be completing the budget. And once you've completed the project details, you can continue below to the main budget and complete each section as appropriate. In the main budget, you'll need to populate column C with costs per unit, column E with a number of units, and then provide any relevant details in column K. You only need to complete the budget for the number of changes proposed in your application and the related activities. So although the budget contains sections for up to 4 changes, you might have only specified 1 or 2 changes. So that's what I mean by that. And then, as previous funding calls, the project management and equipment and refurbishment costs should not exceed 20% of the overall budget. And you can track the overall percentages in the budget category summary section at the bottom of the template. So that's it for the budget template. You'll have an opportunity to ask questions at the end of the webinar, and I'll now pass it on to Paris, who will briefly run through the application process.
Thank you, Salman. Hello, everyone. So I'm going to go over the application process very briefly. So please email your application form and budget to the application@thet.org mailbox by midnight on the 1st of October. This is all we'll be asking you to submit, so just the budget and the application form. If you do not receive any acknowledgement from me or anyone from the team within 48 hours, please resubmit your application. The application will be reviewed by a selection panel, which will include THET staff and external advisors, and all applications will be reviewed by approximately 2 to 3 reviewers, and all applicants will be informed of the outcome via email in October. So only large grants will be shortlisted, and to be shortlisted doesn't guarantee funding. For those shortlisted grants, we will, applicants, we will schedule a short project meeting with you and with the overseas team and the UK team, and that will take place in October, and we will also be undertaking a due diligence assessment during that. So all grants will be notified at the same time, short and large, whether they're successful or not. And if you're successful, move into the contract stage end of October, November. And the project should not start no later than the 30th of November, and inception meetings will be held in November. Thank you. So this is an opportunity for questions.
So there's 2 ways of asking questions. If you have a microphone, you can put up your hand virtually by clicking on a little yellow hand icon, and in that case we will invite you to speak and unmute you, because you're all currently on mute. Alternatively, you can type the question in the question box that is also available. And any questions that we either can't cover today or don't have time to cover, we can follow up by emailing application@thet.org. So just checking now if we have any questions. Okay, we have a question from Chris Vasilas. So Chris, I'm just going to unmute you now. Hi, Chris.
Hi, can you hear me?
Yes, we can.
Yeah. I just have a question about the budget and who will compile it. Is there an expectation that a particular type of person will compile the budget, or do you just want a name?
Hi, Chris. So it really is up to, I guess, whoever is involved in completing the application form and the budget. So, you know, maybe the project manager, or I guess that would be the most appropriate person. But really, you know, as long as it's someone involved in the project, or it could be in collaboration with the any sort of finance personnel within the institution that you're working in. So yeah, sort of anyone related to the project, or a finance in collaboration with your finance team.
Okay, thank you.
Okay. Oh, Enid has a question, so I'm just going to mute you, Enid.
Enid has a question from Uganda, the Lamland project. We've been working very closely with our partners in University of Manchester, and when it comes to budgeting and all those that you have taken me through, we haven't had issues. We've got a very good support from the University of Manchester, plus our volunteers here locally. And I think we'll be able to follow all the steps that you have taken me through.
Okay, well that's great. Do you have a question for us right now?
I don't have a question, because our partners, again, Professor Tina Lavender, had the first appointment, and we discussed, and we're already brainstorming. And so, and now that I'm alone, I think I'll just take the feedback that I've been able to go through what you have taken me through.
Okay, well that's great, Enid. If you have any questions later on when you're completing your application, then feel free to email us. We'll be happy to answer any questions.
Yes, we will.
Okay.
But the guidance was very, very helpful.
That's great to hear. Thank you for the feedback. All right. Okay, we have a question from Itai. Itai, I'm just going to mute you now. Itai, you're on self-mute, so I won't be able to...
All
Itai?
right, okay. Hello,
Okay.
Can you hear me?
Yes. Yes, we can.
Okay, my question is, I see that there are 4 countries which are related to this, but in the Q&A document, it states that neighboring countries as well. We have a health partnership in Zimbabwe. And so my question is, do we submit our application right now at the same time that these 4 countries are submitting theirs, or do we wait for another time?
Submit them. No, you can submit them now. The 4 countries are focus countries, but in the Q&A document we do mention that neighbouring bordering countries in exceptional circumstances will also be considered. But yes, as far as the application process is concerned, the time frame is the same for all applications, regardless of where you're applying from.
Okay, thank you. Can you just give an example of the exceptional circumstances that will apply?
So a neighboring country would be, so if there's Tanzania and Uganda in those priority countries, so Kenya could apply.
Okay, all right. Okay.
Yeah. There is actually a list in the Q&A document with all the countries that are neighbouring countries of those 5 priority countries that we could consider.
Yes, I saw that. Thank you so much.
That's
I
all
think
right.
the question, yeah, so I'm sorry, I think you were asking what would be the exceptional circumstances that would make one of those other countries eligible. Is that right?
Yeah, yes, that's correct.
Yeah, and I think the reasons for selecting the 5 countries. I think there's 2 reasons. One is that DFID has a desire to focus its work, and therefore a smaller number of countries is helpful. And the second is that the evaluation report on the HPS recommended that we seek to encourage health partnerships to work better together, and of course part of this call is also to encourage them to work better with government and other agencies in the health system. And we feel that we can best do that by supporting projects in countries where THET has a country presence, has an office, hence those 5 countries. So with if you're applying for a project in another country, I think you need to make clear, firstly, how well you are working with existing agencies in that country, you know, and that you've got your embedded in those networks, and that lots of stakeholders are, you know, have fed into your project and are going to be working alongside you. And you also need to make clear how you will work with other health partnerships in that country, and potentially in neighbouring countries, if there's if you can see any kind of regional benefits like that. So I think those would be, if you're applying from, say, from
Zimbabwe,
Kenya, from a neighbouring country, from Zimbabwe in your case, if you can make clear how you are, you know, fulfilling those criteria, you know, exceptionally well, then I think you would have as much of a chance as anyone else.
Thank you so much. Thank you.
Okay, there's a question from Kerry Jones. Kerry, I'm just going to unmute you now.
Oh, hello. Just along the same lines, and I think I've had clarification now, but just to be absolutely super sure, your country criteria say that a neighbouring country is eligible if it's a low-income country. Kenya is a middle-income country. So is that something that's just a little bit incorrect in the information? And would it be more likely to gain funding for a low-income rather than a middle-income country like Kenya?
Okay, well, I mean, yeah, we probably should have said low and middle income country, but Kenya is definitely on the list of DFID's priority. Yeah. So yes, yes. Sorry if that was unclear in our documents, but
it's okay. This is all very helpful, by the way. Thanks very much. Yeah. So the second part of that is because it's a middle income country, Kenya, is it likely to be viewed less sympathetically in terms of grant applications?
No. I mean, obviously the 5 priority countries will be, you know, will take precedence, but they won't. It doesn't matter as long as it's on the list and you have you can demonstrate a very strong project, as Dan was saying, in answer to Itai's question. Then you have just as much chance as another kind of low-income country that's in that. Yeah.
That's lovely. Could I just ask one further question, if that's okay?
Yeah.
We have an approach of a new emergent partnership, not based on THET, between a UK university and University Hospital in Uganda, and that is just emergent, and they're quite keen to work with us. Does it matter that they are not a THET partnership and that it isn't our current partnership if we just sort of link the work that we're doing already with our Kenyan partner and map that across to another new relationship that actually isn't a THET partnership?
Well, my colleagues might have other views, but it doesn't matter whether they've received or that they're known to FET, as long as it's an established partnership in some way. So I guess you'd have to demonstrate that
Yeah.
You know, you've worked together before, you have managed projects, even if, you know, no matter how much time you've been established for, that's the main criteria. But it is open to partnerships that are not known to FET, that haven't received HPS funding before, as long as it's established.
Thank you very much indeed. Thanks.
Thank you, Kerry. Right. Oh, we have a question from Chris. Chris, go ahead.
Hi, everyone. I think it was you, Sophie, who mentioned something about the fact that this grant application is not for setting up new partnerships, but if our existing partnership has another partnership within the country with another institution, would it be possible to actually include that within an application? So they would essentially then become a third partner within an existing partnership.
Yes, that's eligible, and I think, yeah, I guess I would say, you know, in principle, that's the kind of thing that we're looking for. I think the focus in this grant stream on health systems and on sustainability and scaling up and access will in most cases mean that an existing partnership will need to bring in other organisations and agencies to enable it to, you know, to achieve those changes. So I think that's yeah, that's absolutely fine. I think you will need to talk about the track record that you've got in the existing partnership, and any previous work you've done, you know, previous contact you've had with that new agency, or work that agency has previously done, you know, without you, but in the area that you're working in. But just to give a sense that between you've got the capacity to deliver the project that you're proposing.
Okay, that's great. Thanks very much indeed.
Thanks. Okay. Just checking for more questions. Here we have a question from Sophia Thompson, who is self-mute. Sophia, can you unmute yourself?
Thank you. Can you hear me?
Yes, we can.
Sorry, just a quick question. I may have missed this. Is it possible to have a copy of at least the slides from this, or even the whole presentation, for our colleagues who weren't able to be with us this morning?
Yes, we'll be sending around the slides and also the recording of the webinar as soon as it's available. So hopefully by the end of today, you should get it, and then you can forward it on to whoever's involved in your application.
That's great. Thanks very much. That's all.
Thank you. So looks like Vicky has a question, but I can't see a microphone, so I'm not able to unmute. So I'll just have to take other questions in the meantime. And Vicky, you might want to type your question in the question section, because unfortunately it looks like your microphone's not working. Okay, there's a question from Andrew Silver. Hi, Andrew.
Hello, from Bangkok. You almost certainly have already answered this, but I've lost the audio for a minute or so at a time periodic. Simple question: how do we obtain the application forms?
Oh, okay. So the application form is on our website. So we have launched a new website. So I'm hoping it's not kind of throwing people off. But we can. So yeah, we can send it to you directly. But for others, just to let you know, it is on our new website. But you might have to scroll down the page a bit, and then there's a section that says call for applications, and if you click on it, on that page there will be all the information that you need, PDF documents, Word, Excel, for your application. So the calls, the Q&A, a link to the application template, which is in Word format, and a link to the budget template, which is in Excel format. But Andrew, I can send that to you if you're struggling to find it, I can send that to you separately afterwards.
Oh, I'm not looking for it right now, but if I don't find it, I'll send you a message. To,
Yeah,
I guess,
okay.
info@FET.org.
Yeah, or application@fet.org is probably
Okay.
yeah,
Right.
is probably the best email. Thank you.
Sophie, so we've just got a question from Vicky. Vicky would like to know the timings of the shortlisting and inception meetings. So after we close the grant call, we have 2 to 3 weeks to review the applications, and then from then we will be notifying those who were unsuccessful, and then we will also be notifying those who we're going to be having, who have been shortlisted, and we're going to be having meetings with, and that should probably approximately take another 2 to 3 weeks, just because we need to make sure that both the UK partner and the overseas partner is available to meet with us. So depending on everyone's schedule, but we hope to make that process fairly quickly. And when we notify the shortlisting applicants, we will notify you in time exactly what we'll be expecting from the shortlisting meetings and documents we would like to see, so that you can prepare, we can prepare, and then that the meeting will be as quick as possible. And from then on, it will be maybe a week or 2 turnaround to notify you whether you have been successful or not. So I hope that has answered your question, Vicky, and if you have any other questions, please let me know.
Okay, I have a question from, I thought there was a question, but no, it's disappeared. Okay, I'm just going to open the question section. No. Okay. Okay, I'm just checking whether we have any other questions before we finish. It looks like we don't. Ah, maybe we do. There's no questions there. Oh, okay, there is a question. Apologies. Right. So we've received quite a few questions through the question box. I'm just going to put up the last slide for some of the people asking for it. Okay, there's a question from Grace Ryan saying that she's curious about the large grants requests. What qualifies as a low or middle income country institution? Does this have to be a hospital, or could it be a smaller primary care facility? Dan, do you want to take that one?
Sure, yes, it can be any institution that is involved in the provision or management or regulation of health care and health services. So as well as hospitals, it would include smaller clinics. It would include, although I would say, I suppose, in the case of sort of small clinics, given the focus of this grant stream, we would probably look for you to be working with, let's say, a district health board that was responsible for the management of several clinics in the area, rather than working with just one clinic. Although, if you could make a case for a single clinic, then by all means. But that kind of institution is certainly eligible, as well as community health worker provision. Also, things like professional associations, like midwives associations or doctors associations. Also, ministries of health, parts of the Ministry of Health at a central or local level. Also, regulatory bodies like health professional councils and authorities. Also, health education institutions, training colleges, universities. So I'm sure that list isn't exhaustive, but I hope it gives a sense that any institution that is involved in provision of healthcare. The only ones, I guess, that we really have particular concerns about are purely private healthcare providers, and in that case, you would have to make a very strong case as to why that was the best institution for you to work with.
Okay, and we have a question from Claire Gordon. We have an established project, but would like to include a new team in a different organisation to widen the impact. They are not part of the established project team. Is that okay? So I think Dan has already touched on that, but I don't know, Dan, whether you want to respond to this as well again.
Sure. Yes. So yeah, I think yes, that's absolutely valid, and I think what a lot of existing partnerships will need to do to meet the criteria of this grant stream, that is to bring in additional agencies and partners who can address different aspects of the health system. So yes, that's definitely eligible. They would obviously the kind of the same questions about track record and capacity, that apply to the existing partnership would certainly apply to the new partnership. We would look for evidence that new partners have the capacity to implement the project that you're proposing.
Okay, there's a question from Edmund Kabur. How many reporting periods will there be during implementation? So there will be at least, so if you take a 12-month project, there'll be at least 2 reporting periods, so at the 6-month stage and at the 12-month stage. But in addition, we're hoping to be to provide a bit more support for projects, bearing in mind that it's a very short period to implement projects, so more hands-on, more support in general at the start of the project, which might mean monitoring visits from us to meet the partners at an earlier stage, and also maybe regular catch-ups over Skype or over the phone.
Another question from Claire Gordon. We struggled to get NHS organisation to host our budget in the past. Do you have any suggestions? Can that help negotiate this? I'm not. That's quite a difficult question. We in the past we've supported partnerships in maybe reworking their budgets as their projects have been ongoing, but it's not something from the outset that we would be involved in. That's really up to you, the partnership, to kind of to establish your budget yourself. When you say that you've struggled to get an NHS organisation to host your budget, I might need to get some clarity on that, and also your organisation and your partnership. So perhaps, Claire, I might get back to you later on and see if we can discuss this a bit further. I think we have contact details for you, Claire, so I'll follow up on that, Claire.
Okay, so a question from Ian Fossey. Is partners' previous experience outside this partnership with other partners in other countries relevant, applicable in demonstrating experience and capacity to deliver? Does it fit best under section 3.1 health system changes? Okay, well, I mean, it would be relevant, but what we're looking to assess is how you've worked together as a partnership. So although it might be relevant depending on the project you're trying to implement, we also want to assess whether you can work together as partners. So you would still have to demonstrate that in that partnership section of the application.
And also whether you have the capacity to deliver the project, and you have a track record, which we've mentioned a few times, of delivering a project. So
yeah,
those are all the things we'll be looking for. So as long as you can demonstrate that in your application.
Yeah, well, we're also looking at how you're going to work together. So it's kind of how you're drawing on each other's expertise and knowledge and capacity to successfully deliver the project, but also what you've done together in the past. Okay, I'm just checking if we have any other questions. No, it looks, oh, okay, we have one question from Enid. Since we have a strong partnership with the UK, do we have to submit 2 separate applications? Well, Enid, bearing in mind that I'm not too sure what your question is, but we only accept applications from partnerships, i.e. a UK institution and a low middle income country institution. So you would have to submit one application as a partnership, or several applications but separately. Yeah. Right, okay, I think that's it. We've got no more questions. So thank you for joining the webinar, and if you have any more questions, please do email us at application@phet.org, and best of luck for your applications. Thank you. Bye.